Hi, I'm Dr. Stram from Elk Grove Pet Clinic, and I'd like to discuss spaying and neutering your pet. Spaying and neutering is a very important responsibility that everyone should take on, because we could have lots of issues with pets that are not spayed or neutered. One of the biggest issues is overpopulation. There's already lots of animals that are waiting to be adopted in shelters and rescue places, and if left unspayed, unneutered, we get a lot of animals that are breeding that probably shouldn't be breeding, and it just gives us a lot more pets that might end up unwanted and euthanized that could have found homes. Concerning a male cat, if left unneutered, a few things happen. One, they really like to wander around the neighborhood. They like to get into fights with other tomcats. They'll wander for miles trying to find a mate. They will also tend to spray urine a lot more readily than a tomcat that has been neutered at a young age. Which can really kind of make the pet difficult to live with if your male cat is urinating all around your house and not using the litter box. It's a very simple procedure when we neuter a male cat. They come in the morning on an empty stomach. We give them an injection to put them to sleep for a short period of time, and we make an incision and do the surgery rather quickly. They wake up within a half an hour. We give them an injection for pain, and they go home the same day, and we don't have to worry about issues with them wandering the neighborhood and spraying around the house. So it's a good thing to do to make sure your pet becomes a pleasure instead of a problem. Female cats, similar issues. If they're left unspayed, again, they can wander the neighborhood, and they end up getting themselves into trouble. They'll find a tomcat somewhere, and will end up with kittens that may or may not be wanted, but it just adds to our population, and there's plenty of kittens out there that need homes. When we spay a female cat, it will prevent her from getting ovarian cancer, because the ovary is something that we remove. The uterus also is removed, so that will prevent uterine cancer. If we spay them very, very young, before their first heat, it will prevent approximately 99% or more of mammary cancers. So we're doing a good job at preventing cancers down the road when they're older, and controlling population. When we spay a female cat, she comes in during the day on an empty stomach. We give her an injection and intubate her and keep her asleep on a gas anesthetic. We do the spay operation where we remove the ovaries and uterus. We close up the abdomen. Sometimes they have sutures, sometimes we use surgical glue to close the skin. They wake up and they go home the same day. Now we've got a similar situation with dogs. Only in a male dog, there's a little bit more reasons behind wanting to get them neutered. A male dog that is unneutered, again, will tend to want to roam, will tend to want to mark their territory, especially if they feel threatened. They may decide to lift their leg and urinate on items inside the house to kind of mark their territory. But they can also have issues when they get a little bit older with prostate problems. They can get a prostatitis from having testosterone long term. They can also get testicular cancer, and they can also get these tumors called perianal adenomas that form around the anus due to the high levels of testosterone. If you neuter these dogs at a young age, say around 5 months of age, it will prevent testicular cancer. It will greatly reduce any incidence of prostatitis, and it greatly reduces the incidence of perianal adenomas. So again, it's a real good idea to neuter these guys. It will make them healthier in the long run and make them a better pet. When we neuter a male dog, they come in on an empty stomach. They're given an IV injection. We intubate them and keep them maintained on a gas anesthesia. We've got expensive anesthetic monitors that we monitor all the animals under anesthesia to check their EKG and their blood pressure and their pulse and their oxygen perfusion. So we're watching them carefully. We make an incision, we do the operation on these guys, we close them up with suture and or surgical glue, and they go home the same day. We give them medication for pain and medication to go home with, so they can maintain pain medication for the next few days so they don't have any discomfort with the procedure. Female dogs, again, very important to spay them at a young age. We try to spay at about 5 months of age, and by spaying them, it will again prevent unwanted pregnancy, prevent the ovarian cancer, uterine cancer, over 99% of mammary cancers if we spay them before their first heat. And it just, again, makes them a better pet. If they're not spayed, they're going into heat approximately every 6 months. They can be leaving a blood-tinged fluid around every 6 months, and it makes them a better pet if they're spayed, and a healthier pet because they won't have to deal with the mammary cancer and ovarian and uterine cancers. When we spay a female dog, come in the morning on an empty stomach. They're given an IV injection for anesthesia, intubated and maintained on a gas anesthesia. We do the procedure, remove the ovaries and uterus, we close up the abdomen. Sometimes we use sutures and or surgical glue to close the skin, given a pain injection and pain medicine to go home on. And the animals go home the same day, and they do very, very well, and it'll keep them happy and healthy for a long life.